Computer. Awesome. Cool. Awesome. All right. So, just want to start like, hi, Dr. Rosales. I thank you so much for spending some time with me. I really appreciate it. Um,
You're
so,
very welcome.
so for the benefit of others, you guys, this is Dr. Daphne Rosales Barragan. She's a family medicine doctor at Rio Health here in Tucson. I'm really excited to connect with her and learn more about family medicine and also like, pregnancy care during the time of COVID. So, so yeah, like just I guess to start off, like how are you doing and how are you feeling?
I'm doing great actually. I'm currently working from home because of the pandemic, the COVID pandemic. But I was enjoying working in the clinic with the proper protection, of course. To stay with that human contact at least.
No kidding. Yeah. So like for the benefit of other people, like can you tell us a little bit more about your daily work, both before and now?
Yeah, so before the pandemic, I was working both in the outpatient and inpatient setting. That means we do some clinic work. The majority of my work is in a clinic basis. So I have my patient panel, and then we follow up longitudinally, and we form really nice relationships with the patients. I work in the south part of Tucson, and we serve the underserved as I work for that community health center. Um, and then besides that, I would rotate through the St. Mary's Hospital in the inpatient adult medicine service. And that also will be serving our El Rio patients. And as a family doctor, I'm able to, at least in the clinic, to see like the full spectrum of family medicine, which, as it says, it's the family. So, babies, newborns, pediatric patients, women's health, and then adult health, and then geriatrics. And in my case, I do have a wide range, actually, a wide variety of them. But I would say maybe the majority is maybe, I don't know, about 50% geriatrics, and then the rest have a lot of newborn that I used to see when I was in the clinic. So that was very nice.
um, so how have things then changed? Like, are you able to do telemedicine at all, or like how do you do patient
Yeah.
care now?
So now, since the pandemic, so I was in clinic, and we are still in clinic, and as as family medicine doctors. So the patients that are considered high risk for complications if they were to get an infection, those are the ones that we're trying to target through the phone visits, or video and audio visits, to keep them at home and help them stay out of exposure or unnecessary exposure. So those patients would be pregnant patients, or patients that are elderly or have diabetes that is uncontrolled, or heart failure that is not well controlled. Um, and and that way the patients are in the comfort of their home, and then we can continue to follow them longitudinally. So we don't, at the end of this pandemic, end up with like all these other chronic medical conditions that are also out of control, or while the hospitals are busy taking care of respiratory issues related to the virus, then they also have to take care of these patients that maybe have complications from their chronic heart conditions, or their diabetes. So I think at least El Rio, we have been very, very fortunate that our clinical leadership has definitely taken a step ahead, and we're able to kind of prevent and target that early on. And for me, because I'm pregnant, yeah, I'm like 32 weeks pregnant. I was advised to stay home and to do all of my visits now from home, and I've been home for almost 2 weeks now. I do miss going into the clinic and interacting with my medical assistants and other physicians, but I do understand that it's safer for me and my baby to be home, and we can still serve the patients video or audio, and it's both my own panel and maybe other providers' panels. But the doctors that are at the center, they do serve again, like I said, like we limit the patient exposure in the clinic, but there we do have a specific space in the clinic for sick patients, which means patients that are maybe showing some signs or symptoms of the respiratory infection related to the COVID virus. So so that's good that, you know, and of course those visits are with protection, and yeah, and that's, I mean, I'm in debt, forever be in debt to those doctors that are, you know, doing that sick visit service to the patients, and then and I'm, you know, very, very grateful to them that they're serving the community still. Mm-hmm.
Well, you are as well. So thank you for continuing to do like the work that you do. And so like, how do you then take care of yourself? Like as being pregnant, as being a provider right now, what, you know, what, first of all, how do you take care of yourself? And then also like, what advice do you have for your pregnant patients right now and anybody else who's pregnant during this health crisis?
So how do I take care of myself? Well, being pregnant in third trimester is a little hard to stay sitting down for long periods of time, in which is required, especially during the virtual visits. So I make sure I have like a water break at least every other patient, and then you know, I walk, go to the bathroom, and at the end of my sessions, I try to definitely stretch, I do yoga. Like yoga is a big part of my life, and I do incorporate it in my patients' visits and my patients' treatment plans. So yoga has been very helpful, not only for like the muscle and ligament stretch necessary after, you know, 8-9 hours of work on the desk, but also like mindfully, like putting your mind at ease, not getting your mind lost in the details, because as a pregnant woman, you know, you're planning for your baby to come, and it's of course very, very exciting, but with the current COVID status, you can get lost in the details of, well, how is it gonna look when my parents come in, or my in-laws come? Am I gonna let them see the baby? Like all of those things that are very uncertain right now, I think that just create more stress, and that of course your baby is going to feel that stress, even if you maybe are unconscious of it. Like it does generate a reaction in your body that of course is transmitted to the baby. So I try to stay on a day by day vision, and just daily goals, like for instance going out for a walk. Our neighborhood is pretty far away from other homes, but even if it wasn't, like, you know, wearing appropriate protection, but going out for walks like around sunset, like when my husband comes in, staying supportive with him, and then even just like what are we going, the meals, the daily meals, that actually, you know, it's little accomplishments because otherwise life would be right now currently very monotonous, and it would just feel dull. So and then sleep, of course, important. In the third trimester, it's very hard to sleep fully throughout the night, at least for most of us. But I try to make sure that we get at least, you know, 7 to 8 hours of sleep per night. And staying hydrated is very important too in this throughout pregnancy, to prevent like those contractions that may be, you know, the false contractions, or the Braxton Hicks, as they're called, or like cramps, or low blood pressure, headache, high heart rate, like all of those things that come from dehydration that could be very, very well prevented. So in this case, I would say, you know, I would tell my patients, my pregnant patients, just kind of do as I do instead of do as I say, because I am trying to practice what I preach also. So yeah, it would just be like focus on right now, on maybe, you know, the day that's coming ahead of you, but don't get lost in all those details because they're uncertain. And maybe, you know, things get better by, if they're due in August, September, things will get hopefully back to normal by then, and all of these uncertainties and that stress was unnecessary. But currently, staying in the now, I would say just stay as home as I do, like try to stay home as much as possible. And whenever you go out, because the CDC and the WHO do recommend to for us to be protected with like our mouth and our noses to be covered with a face mask, and then make sure that people are staying at least 6 feet away from you, especially those strangers. Like if you're going grocery shopping, which you can, and I actually find that very therapeutic for me, because if I didn't leave my house at all, and try to go with somebody, of course, that's going to be there to help you, because you do need maybe some help with lifting some things. But keeping your mouth and your nose covered, and washing your hands as soon as you get home. And the mask, I found also that helps with protecting yourself from yourself, because sometimes we try to touch, we tend to touch our noses or our mouths, and that way you have a mask. It could be anything like a bandana or a scarf. If it's cloth, I do recommend that as soon as you come back from visiting or your very close family members that have also been quarantined, or going grocery shopping, you wash it so that you can use it again, because it does need to be washed after being exposed, or technically exposed to the outside.
Okay. Oh, wow. Okay. Awesome advice. Need to be taking some of that advice, actually. In general. Are there any changes to like the types of screenings that you would recommend for patients right now? Or is it just keep everything as normal? Or like, what are your thoughts about that?
About screening for the virus, and particularly to pregnant patients?
Mm-hmm.
So we are considered high-risk patients because we're pregnant. That means the reason is because our immune system is considered to be a little bit less active. Like it's worried about, so your immune system is going to identify something that doesn't belong to your body and try to attack it. So in pregnancy, you're growing another human, and technically it doesn't belong to you. So your immune system sort of needs to tune down, calm down, and so that the baby continues to grow. And so because of that, we have that relative immunodeficiency or weakened immune system. So that's why we consider high-risk patients. So as with any other high-risk patient, like if you start feeling like you get the flu, like you're having a very bad cold, like you have a runny nose, you have a cough, it's hard to breathe. And I know that's hard to gauge in pregnancy, because sometimes when you get to the 3rd trimester, it's hard to breathe just because your belly is getting bigger. But if it's not just sporadically, like if it's all kind of coming together, like it's hard to breathe, you're developing a cough, runny nose, a headache, your body aches, like, and you have a low-grade temperature, or even if you don't have a thermometer, like you feel hot, you feel like you're having a fever. So clearly you're getting, that sounds like the flu for most people. Maybe a sore throat too, because the flu causes a sore throat. If you're feeling like not yourself, like you're under the weather, and it's not just for a few hours or one day, then definitely there's a recommendation to, of course, call your OB or your family medicine doctor, or your primary care provider, because if at least at El Rio, what we're trying to do is to catch those patients over the phone, so that we can say, okay, no, it doesn't sound like it. Sounds more like a cold or a sinusitis or something else, and stay home, but we're going to follow up with you over the phone in a couple of days. Or yes, you definitely need to come and get tested. So we're trying to reach our patients first via a way that is not going to expose them to even more sickness in the real world, but that we're still going to provide them with that care, that follow-up, that very close follow-up. And of course, if it's the middle of the night and there's a high-grade fever and you can't breathe and having maybe chest pain, then you, of course, need to call the paramedics, or which is the first thing I would recommend, or go to the ER for that reason. Also, it's important, as I said earlier, it's important to stay hydrated, because you could be having body aches because you're dehydrated, and that will of course cause more contractions, which initially could be false contractions, but that would also predispose, or could predispose to a preterm labor. And then Tylenol is your best friend if you have back pain. Tylenol is the best thing to take. But if you're kind of taking it to consistently like feel better because you're getting a fever, or you're getting like pain everywhere in your body, or a headache consistently, then that's when I would say just reach out to the primary care provider, ideally first through the phone or through the video and audio services, just to prevent your exposure. Because imagine, like in the ER, everybody, they're really, or even just by statistics, at least one person is going to have some sort of virus, not necessarily just the COVID virus, but some sort of disease or infection that gets transmitted via, droplets, or being in close proximity. So that's, of course, we don't want our pregnant patients to be sick. And then every physician or practitioner should have the guides, the current criteria to test us as pregnant patients, which is some of the things that I mentioned. Also, if you don't have symptoms, but you know that you've been in very close contact with somebody that has a positive COVID test, and close contact means somebody like within 6 feet from you, and you guys know that maybe you were just talking, maybe it's your partner, who knows, then that's another reason to call your provider, because under some circumstances, it would be recommended to be for you to be tested. But on the bright side, some of the patients that unfortunately have acquired the virus that have been pregnant have delivered, in the majority, very healthy babies, and they have had good outcomes. So in the 3rd trimester, so those are good news too.
Wow. That's amazing to actually have some good news, and the whole span of all this is amazing.
Yeah.
I have 2 more questions for you. One, do you have any visibility into how the delivery process is changing, or what people should be aware of if they have to deliver in the near future, or in even the near-ish term in the next several months?
I know in Tucson, they're only allowing one guest or one companion with the patient. Normally we would allow 2 or 3, or as many as the patient would feel comfortable with, but right now it's only 1. And I know that could change if our numbers rise, or like if we see, like, not if our numbers rise, if we see like a ramp up in the rate of cases, because at least right now for Tucson or for Arizona, we're still getting more cases, but I also think that's because we're testing more. We weren't testing a lot before, now we're testing more. But if we see like an increased rate of cases, then there may be, or locally at the hospital, if there is there are more cases, then they may actually not even let the companion go into labor with the patient, which is nerve-wracking in a way for you as a pregnant patient, or for us as pregnant patients, but it's also a little bit discouraging for the partners, or that other labor companion or labor partner that was going to be there. And I don't know if I would assume that they would allow like an iPad or something, some sort of technology, so that the partner could at least be there, present throughout some of the laboring process. Also, I see a lot of or some of the patients are thinking about, or some of the community is thinking about like laboring more at home, like in that early stage of labor where you're just getting a little uncomfortable and then your contractions are coming, but not too often, which is what normally I think as a physician you will tell your patient if your contractions aren't happening every 4 minutes, and they don't. So if your contractions, the reason to come to the hospital would be when your contractions happen every 4 minutes for a minute for an hour. So it's like 4-1-1 rule.
Okay.
So every 4 minutes you're getting the contractions and they last for an hour. So you need to have a timer with you. That sounds a little over the top, but actually it helps you gauge things better. And then they're being consistently for at least an hour. That's when generally that relates to, okay, the start of active labor, which is when your body's gonna start making those changes more rapidly to help baby come down the birth canal and eventually for you to deliver. So before that, we just say, okay, yeah, stay home, keep track of things, or drink water. Maybe they're not real contractions, relax, find your, we tell patients to practice their ways of coping with pain or anxiety or stress. So, so a lot of the community or pregnant women in the community, that's what I think they're trying to practice more now, like trying to do that more at home. Of course, if that shouldn't be a decision that you make without touching base with your OBGYN or your family medicine doc or your midwife. You should, you know, reach out to them. Hey, I'm feeling like this. What do you recommend? Or I'm thinking about doing this. Are you okay with that as my provider? Because of course your situation may be different. Not everybody, you know, everybody's situation is the same. Yeah, so I personally, I think that's what we would do. We would start trying to reach out, practice our pain management techniques or, you know, breathing techniques at home until our doctor tells us to go to the hospital. And that's another thing. Like, I think it's this time, the positive of this time is that I think it expands your spectrum of resources. And as a woman, like as a pregnant woman, it really makes you dig into that like powerful and positive side of yourself. Like, yes, I can do this. Like, at least that's what I envision, and I hope that a lot of women have. That it's scary, you know, it is intimidating to be delivering in this time, but also it's almost of a challenge to reach out to that like strong, powerful, not like raw natural woman that or raw woman that sort of has those, because we have that power within us. Our body knows how to grow baby, because we don't tell it how to grow the baby. And then it just, I think it challenges you to reach out to the things that you have and the people that you have with around you, and the techniques that maybe you haven't developed within yourself, or you have, like breathing techniques or positions or like yoga or the birthing ball or water, like warm water, all those other methods that are not invasive. I think those are very powerful and they're very accessible to a lot of people. And I think these times actually make you reach out to those techniques more. And then of course, we have more communication with your provider. So I think that's a beautiful thing.
Wow, no, that's amazing. Well, I mean, you kind of touched on it already, but I wanted to kind of end on an additional positive note. Like, what gives you hope right now? Well, there's so many people that are so stressed out, you know, pregnant or not, or, you know, with medical conditions or not, and it can be really overwhelming to be in a pandemic or isolating. What personally like gives you hope, and what can you share with your patients and with, you know, the general public that might give them hope too?
I think we're very fortunate because we have this life coming or developing inside of us, or inside of me. So but I think us as pregnant women, like we bring joy in this area of crisis. Like when I go out, with my mask, of course, um, everybody smiles at me. And, you know, before the pandemic, I would be like, oh, that's nice. Oh, how cool. Oh, okay. But now, of course, it still feels good. But I don't know, like taking it from their perspective, like we bring joy, we bring up a smile to strangers. And really, I think people need in this time even more of a reminder of our kindness, of the kindness in the world and the beautiful and positive things in the world. So how amazing that you as a pregnant person, as a pregnant woman, can actually, you know, like emulate, no, inspire that in a stranger. Like that's just amazing. um so that really keeps me in a positive light. Also focusing on my baby, on the near future, like on the how, I don't know how I'm gonna name my baby, or you know, what outfit or what clothes, or like washing the clothes and organizing the clothes, and like seeing, also being more aware of kids around you, and like envisioning your child, like, oh, like is my, like just focusing a lot on the baby. I think it really keeps me positive, and I think that hopefully should or will bring that positive note on the pregnant patients. And also, I think I generally thrive on negative things, but when there's a lot of uncertainty, the thing that keeps me going is that, you know, every day that passes by, we're a day closer to the end of this pandemic. It's a very general statement, but I think if I remind myself of that, that also helps me stay positive. And then for patients that maybe aren't pregnant or don't have a pregnant family member or friend around them, I think it things that I tell my patients to keep them positive is just to to realize, to be present in the moment, and to realize like all those things that they have, that they already have, that is actually what they need, and that with that, it's keeping them healthy, it's keeping them alive, it's keeping them yeah, like just grateful to be alive. So I just invite them to be very mindful and be very grateful of the things that they have already, that's making that uh, and to realize that, yeah, that's what I need. Like maybe before they had plans to get a new car or to get something else, but that's actually not what they needed, and what they have around them is enough. So yeah, and I do recommend that when we watch the news or read the news, that we are selective of what we read, and that it's only, like everything, has to be on the right amount. So don't watch the morning and the afternoon and the evening news, because they're all saturated with COVID information. So just pick your source and do that once a day, because it's important to stay informed. But other than that, yeah, find something, maybe a new hobby, it could be writing, journaling, drawing, doesn't have to be good, gardening, or find something new that is going to help cope with that dullness or that maybe anxiety provoking time. And yeah, a lot of my patients, they're knitting, they are watching cooking videos, they are in the garden. Some of them are fortunate enough to already have like a stationary bike at home, so they're doing that. I had one patient who recorded herself to show me that she was doing that. So even that, like, you know, and if they have access to social media, to use it on a positive note too. Like you can work out with your friends, just you watch a video together, everybody in their phones or on a TV, and then everybody's sort of calling each other on video to sort of see each other. and you keep motivated, and you can debrief at the end and, hang out. I think if you do keep that consistently, it won't feel like it's such lonely times.
That's great suggestions. Seriously, thank you so much for sharing them. And thank you for also reminding us, like, it is true, like every one day we're getting closer to the end. And that is super powerful to keep in mind. It's hard to actually, but thank you, seriously. Well, thank you for spending some time with me today, and sharing your expertise, medical expertise, and life expertise with us. Really, really appreciate it.
Oh, you're very welcome. It's nice. It's enjoyable. See, I'm very happy that you asked me to talk, to hang out.
Thank you.